Did you know that every day your blood travels over 90,000 kilometers to nourish your heart, brain, and every living cell? But after age 60, blood vessels start to harden, clog, and narrow, slowing down circulation, reducing oxygen to the heart, and leaving the body tired. This can lead to dizziness, cold limbs, heart failure, or stroke, all caused by what we call silent artery blockage. In this video, I, Dr. Karl Neumann, a cardiologist in Berlin, with more than 20 years of working with elderly patients, will share a simple, safe drinking water recipe that helps clean blood vessels and improve circulation, especially for people over 60 years old. Dear viewers, the circulatory system is one of the body's most vital systems. It works non-stop, 24/7, to deliver oxygen-rich blood and nutrients to every cell, and to remove waste products in return. The heart functions as the central pump, while the blood vessels, arteries, veins, and capillaries act as a vast highway system throughout the body. For older adults, healthy circulation plays a key role in supporting memory, vision, and hearing, nourishing muscles for stable mobility, protecting the heart and brain from stroke or heart attack, boosting immunity and general vitality. According to the European Society of Cardiology, 2019, after age 60, the risk of LDL cholesterol building up in artery walls increases significantly. Over time, this forms atherosclerotic plaques made of fats, calcium, and dead cells. These plaques narrow the arteries and block blood flow, especially dangerous if this occurs in the coronary arteries or those supplying the brain, as it can lead to heart attacks or strokes. Poor circulation rarely happens without symptoms. In fact, the aging body often gives us early warning signs, though they're easily dismissed as just getting older. Common symptoms include dizziness upon standing, cold hands and feet, mild but persistent headaches, poor memory, or difficulty concentrating. Some seniors may also feel fatigued after short walks, numbness or tingling in the limbs, or notice that nails grow slower, all signs that blood isn't reaching tissues properly. According to the Journal of Gerontology, 2020, over 40% of people above age 65 show signs of peripheral circulation problems, but most go undiagnosed due to subtle and gradual symptoms. There's a serious reality we must acknowledge. When circulation declines, damage is not limited to limbs or memory. It affects the entire body, especially the heart and brain. Inadequate blood flow forces the heart to work harder, leading to heart failure over time. Similarly, reduced cerebral circulation increases the risk of stroke and cognitive decline. A study in the European Heart Journal, 2018, seniors over 65 with a 20–25% reduction in cerebral blood flow are 2.4 times more likely to suffer a stroke. Moreover, atherosclerosis progresses silently, year after year. Plaque buildup narrows arteries, raises blood pressure, and significantly increases the risk of heart attacks. That's why early intervention is crucial, ideally before severe symptoms appear. At this stage, natural solutions, dietary adjustments, and lifestyle changes can be most effective. In this section, I'd like to introduce a natural drink recipe that has been used by many nutrition experts and traditional medicine doctors across Europe as an effective complementary remedy. What makes this recipe special is that all the ingredients are simple, easy to find, and backed by scientific evidence for their cardiovascular benefits. I don't call this a medicine. Rather, it's a part of a smart lifestyle, where prevention is better than cure. By adding this drink to your daily routine, you may help gently lower blood pressure, reduce blood lipids, improve blood flow to the heart and brain, and most importantly, feel healthier, clearer, and lighter each day. Now, let's explore the recipe in detail and understand how each ingredient works. 1. Fresh ginger. Vasodilation and anti-inflammatory ginger contains an active compound called gingerol, which helps reduce inflammation in the blood vessels, making them more flexible and easier to dilate. A study published in the Journal of Nutrition and Metabolism, 2020, showed that ginger reduces blood viscosity and may help lower blood pressure slightly in older adults. Especially for seniors with poor circulation, ginger can increase peripheral blood flow, reducing cold hands and feet, and the fatigue often felt while walking. 2. Lemon, vitamin C to support blood vessel walls. Fresh lemon is rich in vitamin C, a powerful antioxidant that helps protect the endothelium, the thin lining inside the arteries that's often damaged by cholesterol plaque. Additionally, citric acid in lemon helps dissolve triglycerides, supporting the cleansing of blood vessels. 3. Garlic lowers bad cholesterol, prevents. Clotting garlic is one of the most well-researched natural ingredients. It contains allicin, which helps reduce LDL, bad cholesterol, and prevent blood clots from forming. A study in the American Journal of Clinical Nutrition, 2016, found that taking garlic consistently for 12 weeks significantly improved blood lipid profiles and increased arterial flexibility. 4. Apple cider vinegar supports fat metabolism and lowers blood pressure. Apple cider vinegar contains acetic acid, which helps metabolize excess fat in the bloodstream, reducing triglycerides, a major risk factor in atherosclerosis. Some small studies in Japan and Germany have shown that regular use of apple cider vinegar for 4 weeks may gently lower systolic blood pressure. For honey protects blood vessels from oxidative damage. Raw honey is rich in flavonoids and polyphenols, powerful antioxidants that help neutralize free radicals, which cause inflammation in the blood vessels and contribute to early atherosclerosis. In addition, honey has a soothing effect on the digestive system, reducing discomfort when consuming other acidic or spicy components in the recipe. Now, I'll guide you through how to prepare this recipe right at home. No fancy equipment needed, just a few simple steps, and you can make a heart-friendly drink by yourself every day. Ingredients to prepare: 1 piece of fresh ginger, about 5 to 6 centimeters, cleaned, peeled, and either crushed or thinly sliced. 1 fresh lemon, juiced. 1 small garlic clove, finely chopped or crushed. 2 teaspoons of raw apple cider vinegar. 1 teaspoon of raw honey. 500 milliliters of warm water, about 40 degrees, not too hot to preserve active compounds. How to prepare: boil the water, then let it cool down to around 40 degrees C. Add the ginger and garlic to the warm water first, and let sit for 5 minutes to release their active compounds. Then add the lemon juice, apple cider vinegar, and honey. Stir well. You can strain out the solids if you prefer a smoother drink. Note: do not use hot water, as it can destroy beneficial enzymes in the honey and the vitamin C in the lemon. When to drink it? The best time is in the morning, about 30 minutes after a light breakfast or meal. If you have a history of gastritis or stomach ulcers, drink it after meals and reduce the amount of lemon or garlic depending on your body's tolerance. You can take it daily for 2 to 3 weeks, then take a 1-week break before continuing in cycles. With just a few minutes each day, you are actively supporting your blood vessels in the most natural and safe way possible. Dear friends, although this is a natural and gentle formula, to achieve the best results and avoid unwanted irritation, seniors should use it with the correct dosage, timing, and method. Here are the specific guidelines. Dosage: each serving should be about 150 to 200 ml, equivalent to 1 small glass. With a prepared 500 ml batch, you may divide it into 2 to 3 servings throughout the day if preferred. However, do not exceed 500 milliliters per day. Best time to drink. The ideal time is in the morning, about 30 minutes after a light breakfast or meal. If taking an additional dose in the afternoon, do so after a snack, not on an empty stomach. Special considerations. People with stomach issues, such as ulcers or acid reflux, should reduce the amount of lemon and garlic and always consume the drink after meals. Those taking blood thinners, heart medications, or antihypertensive drugs should consult their doctor before regular use, as some ingredients may mildly interact with medications. If you experience bloating, belching, or discomfort, reduce the frequency to 3 times per week instead of daily. Remember, every body reacts differently. Listening to your body's signals and adjusting accordingly is the key to making this formula effective, safe, and sustainable in the long run. Dear viewers, we've explored a lot together, understanding how blood circulation works, the dangers of poor vascular health, and how a simple natural drink can make a difference right at home. So what exactly can this drink do for people over 60? First, it helps improve peripheral circulation, which means warmer hands and feet, less tingling or numbness, better mobility, and less fatigue during daily activities. Second, it provides comprehensive cardiovascular support by reducing blood lipids, gently lowering blood pressure, and protecting the blood vessel lining, endothelium, from aging and micro-damage. Third, it may lower the risk of stroke and heart attack through improving vessel flexibility, preventing plaque buildup, and reducing the chance of silent blood clots. And most importantly, this formula is easy to make at home, requires no special equipment, causes no side effects if used properly, and fits perfectly into a proactive, preventive lifestyle. So, what's my final advice? Not everyone needs medication right away, but everyone needs to take care of their blood vessels every day. As we age, our circulatory system becomes more delicate, but the good news is we can support it naturally with smart nutrition, herbal remedies, and positive lifestyle choices. So I encourage you to try this drink daily for 2-3 weeks. Listen to your body. You may notice small but meaningful changes: better sleep, lighter steps, and a clearer, more refreshed mind each morning. And remember, protecting your blood vessels means protecting your health, your independence, and your peace of mind in your senior years. Dear viewers, if you found today's content helpful, please don't keep it to yourself. Share this video with your loved ones, friends, especially those over 60. A small action can lead to a big difference in the health of your entire family. Because having the right knowledge and taking proactive care of your health is the first step to living happily and healthily after 60. We cannot stop time, but we can slow down the damage it causes to our blood vessels, our heart, and our memory. And if you're interested in topics such as cleansing your blood vessels, preventing stroke, improving brain circulation and memory, then don't forget to subscribe to the channel and turn on notifications so you won't miss our next video.